Hello, everyone. Thank you for tuning in to our webinar today. Our webinar is entitled, Does Place Matter? An Introduction to the Social Determinants of Health and Health Equity. My name is Hannah Smith. I'm a health educator here at Hamilton County Public Health.
And I'm Tom Boeshart, Senior Epidemiologist here at Hamilton County Public Health.
And we'll be your presenters today. We hope you find it enjoyable and learn some stuff along the way. So let's get started. So what's on tap for today? What are we going to go through? First, we're going to start out by talking about the goal of today's presentation. Then we're going to define what are social determinants of health, what is health equity, and how does all of this relate to Hamilton County Public Health and the overall We Thrive initiative. Then we're going to explore equity versus equality and the differences between those, and why are we focusing on the social determinants of health? What's the importance of this topic? And then we're going to dive into socioeconomic status, determining the root cause, and what can a We Thrive team do to address said issues. So the goal for today is to provide an introduction to the social determinants of health and health equity and how the We Thrive teams can address the social determinants of health within their communities. So what are social determinants of health? The Kansas City Community Toolbox defines it as the broader social factors, such as income inequality or social exclusion, that lead to or influence health and development outcomes. The CDC also defines it as life-enhancing resources whose distributions across populations effectively determine the length and quality of life. So what does this mean? Basically, this shows us that our health is not only determined by the decisions we make in life, which I think most people assume is true, but rather the social and environmental factors that shape who we are. There is current research on social determinants of health that have three overarching themes, and those are income inequality, social connectedness, and a sense of personal and collective efficacy. So we're going to describe all of these very briefly. So starting with income inequality, this refers to the economic and social equality that determines the health and average lifespan of the country. In other words, your zip code determines more about your health than your genetic code. This is because of gaps or disparities between the most affluent and the least affluent. So those who have a lot of resources versus those who may not have as many resources. This can be monetary, this can be people, spaces, think very broadly here with this. For example, the United States lags behind Japan, Canada, Sweden, and other less affluent countries when it comes to the lifespan of their citizens. Social connectedness is important as well, and many studies indicate that belonging, whether this is to a large extended family, a network of friends, a social or volunteer organization, or even your faith community, is all related to longer life and better health, and also has a bigger role in community participation. And then there's sense of personal and collective efficacy, which refers to a person's sense of control and confidence over their lives. Are they able to do the things they want to do, and do they have the confidence to pull it off? People who are more aware or have a strong history of efficacy, whether that be with their family or social network, tend to live longer, maintain better health, and participate more vigorously in civic life. So from those three themes, we identified the five major social determinants in our eyes. So these are economic stability, educational attainment, social and community context, neighborhood and built environment, and health and healthcare. So breaking these down even further, we'll start with economic stability. We all know that money dictates many aspects of our lives and often controls what we can and cannot do. I think everybody is aware of this. This is where socioeconomic status comes into play, which Tom will touch on a little bit later in more detail. But basically, a person living in poverty is more likely to have poor health outcomes as well as higher level of disease and disabilities. People living in poverty may have limited access to care and may have issues with employment, food security, and housing stability, which are all factors that play a role as well. Educational attainment is also important, and this refers to high school graduates, GED certificates, college degrees, but it also takes into account childhood education and development along with language and literacy. So making sure that people have programs such as Head Start, that students are enrolled in preschool and are really getting those basic education needs at an early start to make sure that they'll be prepared throughout life. Language and literacy, so making sure that not only can people read, but can they read our documents provided in their native language. So taking all those things into account is vital. As we know, GED holders have lower earnings than those with high school diplomas, regardless of their age, race, sex, and ethnicity. And taking it even farther, a college graduate earns on average $36,000 more a year than someone who didn't finish high school. And this is coming from the Health Equity Institute. So those are a lot of big differences. Those things are really going to impact who we are and our lives. Then we're going to move on to the social and community context. So this is really looking at that social cohesion. So whether it's your family, your peers, people who you worship with, your coworkers, anybody that's really involved in your life who are people and who are social. This also refers to civic participation, so whether there are active leaders in the community, nonprofit organizations, again, churches, mosques, or synagogues. And then it's also looking at incarceration rates, which we know can have a huge impact on families, and discrimination and equity and people's perceptions around those things. So if people have a negative view on police, that's really going to affect the dynamics of their community, especially in terms of violence and crime. Neighborhood and built environment really refers to the physical environment that we live in, and within that environment are access and availability of healthy foods, quality housing, crime and violence, and other environmental conditions that may influence what we can and cannot do. And then finally, there's health and health care. So having access to health care and primary care is very important, but also having health literacy. So making sure that you understand what you're being told, how to take prescriptions, when to go to the doctor, how to navigate websites to find care. All of these things are really going to determine what our health is.
So as Hannah kind of illustrated before, the social determinants of health can really impact the health and well-being of individuals, families, and communities. A basic principle of public health is that all people have the right to health with the ultimate goal of achieving health equity. Health equity is defined by Healthy People 2020 as the attainment of the highest level of health for all people. Achieving health equity requires valuing everyone equally and focused in ongoing societal efforts to address avoidable inequities, historical and contemporary injustices, and the elimination of health and healthcare disparities. Health disparities are the health status or health conditions between groups. Most health disparities affect groups that are marginalized because of socioeconomic status, their race, ethnicity, sexual orientation, gender, disability status, where they live, or really a combination of any of these. Individuals that are in these groups not only experience some of the worst health outcomes, but they also tend to have less access to the social determinants that support health, such as healthy food, good housing, safe neighborhoods, and freedom from racism and other forms of discrimination that Hannah talked about earlier. Health disparities are often referred to as health inequities, and when they're a result of these kind of systematic and unjust distribution of these critical conditions, the overall goal of health equity is to ensure that everyone has the opportunity to attain their full health potential. So the question now really is, how does health equity relate to the We Thrive initiative in Hamilton County Public Health? Well, health equity is kind of this natural fit with the mission of both Hamilton County Public Health and the We Thrive initiative. The mission of Hamilton County Public Health is Hamilton County Public Health educates, serves, and protects our community for a healthy future. The mission of We Thrive is to create a culture of health, safety, and vitality throughout Hamilton County. So we at Hamilton County Public Health really believe that everyone deserves the opportunity to live a healthy, fulfilling life, free of health disparities and health inequities. It's going to take some time, but we believe that we can get there. We can achieve and sustain a healthier community for everyone by working collaboratively with others. Having healthier communities kind of reinforces the economic vitality of the region because you have a healthy workforce. We also work to provide accurate and timely information, data, and various services that can be used to help inform and equip residents to make healthy choices that strengthen the entire community. So one of the things that we need to talk about is this difference between equality and equity. We already kind of talked about equity. Equity and equality are kind of two strategies that can be used in an effort to produce fairness. Equality is treating everyone the same. Equality aims to promote fairness, but it can only work if everyone starts from the same place. But not everyone starts from the same place, and not everyone has the same needs. Equity, on the other hand, is giving everyone what they need to be successful. When you kind of look at equity, it appears to be unfair, but what it's doing is it's actually actively moving everyone closer to success by leveling the playing field. However, we know in reality that's not the case. Not everyone receives what they need to move closer to success and achieve health equity. Oftentimes, there are some groups that receive the most of the resources, while other groups are kind of left without any resources or have them taken away. When this occurs, those groups who are left without resources often will suffer from an increase in health disparities and have less access to the social determinants of health that support the health of their community.
So why focus on this? Why are all these things important, and specifically, why focus on social determinants of health? And the CDC, the Center for Disease Control and Prevention, has created a health impact pyramid that really helps illustrate this. So as you can see, this pyramid shows that the things at the top have the smallest impact, while the things at the bottom have the largest impact. So we're going to go through each of these and give some examples to show why it's relevant. At the top, you can see that there's counseling and education, which is important to make sure that individuals know why to be physically active or why it's important to eat healthy. We're all kind of told this information when we're little, but as we grow and as we become adults, it needs to be taken a step further. So educating is the first key, but it's really not going to encompass everything that we need. So that's why we moved to clinical interventions. So these help to control chronic diseases and other health problems through management of illnesses to make life more comfortable. So this can be prescriptions for high blood pressure, prescriptions for high cholesterol and diabetes, things like that. Then there's long-lasting protective interventions, which refer to efforts to prevent diseases, such as vaccinations and colonoscopies, to address current health behaviors like smoking, with treatment to kick the bad habit. Then we move on to changing the context, which is what We Thrive predominantly focuses on. So some examples of changing the context is really changing the environment, changing what we do. So taxing tobacco or junk food, for example, is a great way to deter people from buying those products. Creating smoke-free laws, whether in restaurants or on village or city property, is another great way to prevent people from doing those things and reducing secondhand smoke exposure. These efforts are designed to make healthy choices the easiest choices because, for example, if a pack of cigarettes is too expensive for someone's budget, they may not purchase them. And then finally, we have the socioeconomic factors, and changing those are really going to be the most important things and have the biggest impact on populations because they often pose the biggest barriers. So things like poverty, violence, and inequality make it very difficult to address other health problems. For example, we can tell people that it's really important to exercise and to get that physical activity, but if people don't have enough money for a gym membership, or it's too dangerous to go running outside, it's really going to be hard to make sure that they're getting physical activity to prevent chronic diseases. So addressing those socioeconomic factors, those social determinants of health, is really going to make our work have the most sustainable change.
So as Hannah kind of mentioned before, the largest impact on health are addressing these socioeconomic factors, or looking at the socioeconomic status of individuals and families. So the question now is, so what is socioeconomic status? Socioeconomic status are measures of a person's social, economic, and work status. So social status is measured by how many years did that person spend in school. Was it 12? Was it 16? Was it 5? Economic status is measured by how much money a person earns each year. The work status is measured by whether or not a person has a job. So what we can do is we'll take a little bit of a look at some potential differences between individuals that have a high socioeconomic status and individuals that have a low socioeconomic status. So individuals who have a high socioeconomic status are those that may have a college degree, like a bachelor's degree, a master's degree, or a PhD. They may even earn a higher level of income and have a full-time job. On the other hand, individuals that have a low socioeconomic status are those individuals who may not have graduated from high school. They don't earn enough or make enough money to live comfortably because they are either in a low-paying job or they may even be unemployed. Now, there are going to be times when individuals kind of may have a combination of both of those factors. Those individuals are going to fall in the middle and have kind of a medium socioeconomic status. A socioeconomic status really can greatly impact an individual that a person has to get health care. Typically, a higher education level is associated with better health outcomes, and it's because an individual who has more education, like a bachelor's degree or master's degree, is more likely to have a job or be able to get a job that's going to pay them well and provide them with health insurance and paid sick leave. If individuals who have higher incomes and have health insurance, they also are going to most likely have that disposable income that they're going to be able to then go access good, adequate health care and seek early treatment for any diseases or illnesses that they may be subjected to. An individual who's going to have low socioeconomic status, they may not have that ability to access the health care, and this could be because they may not have health insurance or they can't afford to go out and seek treatment for any diseases or illnesses that they're going to get. They may not be able to take time off work to go see a doctor for a problem because they may not be able to take paid sick leave. They may have to take it unpaid, which means they're going to take a cut in their pay for their money that they're going to bring home. Or they may not even be able to have transportation to go actually see the doctor to get the treatment that they need.
So what causes all of these things? Why are people born into poverty? Why aren't people involved in civic participation? This is where determining the root cause comes into play. And to do this, we like to play the why game. It asks, but why, for an issue, whatever it is, until the root cause of the issue can be determined. So we're going to go through an example to see how this plays out. So just look at one at a time here, but this is an example that looks at participation in elections. So that's going to be our identified factor, and you can do this activity with any factor. It doesn't have to be voting, but this is just a good way to show you how it works. So the identified factor is few community members participate in elections or civic activities. But why? Why is this? And it's because community members are not registered to vote. Well, why aren't they registered to vote? And this may be that community members do not understand the importance of registering to vote. Well, why don't they understand the importance of it? Maybe community members don't understand the election voting process. Maybe they don't know where to register to vote or how to or where to go. And why don't they know this? The process was not explained to them in school or any other venue. So then, once we're looking at all of these reasons, we really want to see, could this have been prevented? In this instance, yes. This could have been prevented by having local government provide education on elections and voting processes and the importance of voting. So this could have been through a community forum. They could send out flyers and mailboxes for people. having sort of that grassroots participation to educate people. But the point is to not just look at an issue and just say that is the way it is. Everything has a history and a root cause that allows us to understand why is this a health issue and can it be resolved. I think that's the most important thing moving forward is that, you know, while a lot of these issues may seem daunting and we're just an individual, we might not think we have power, but we do have power. We can take small steps that can have a big impact, and that's what We Thrive really aims to do. So, specifically, what can your We Thrive team do? And We Thrive teams create social and physical environments that promote good health for all. So we explore how programs, practices, and policies within a community affect the health of individuals and families. So these are just 5 strategies that have proven to work in some of our communities. But again, these are just some examples. You're not limited to these at all, but we just wanted to give you some insight to see that it can be a very simple task that can have a big impact. So community gardens, for instance, are a great way to enhance the accessibility of fresh fruits and vegetables within a community. So these can be individual gardens that people have in their backyards, or it can be something bigger as part of a church or school or a community organization that helps build gardens. There are several of those types of programs throughout the county that can really make sure that people have access to healthy food. Furthermore, community gardens teach people how to grow food and really helps with that self-efficacy to build people's confidence and so that they can take control to make sure that they have healthy food. Another strategy is having GED or English as a second language classes at churches or other places of worship. So this helps to enhance literacy and help people further their educational attainment, whatever that may be. So it's really just doing an extra push to allow people who may need these things, these sorts of classes, to be offered not in a university, but maybe in a community organization that they may trust more. And it's a really good way to make sure that everybody is able to get the education that they need. There's also walking school buses, which is a strategy that was proposed by the Safe Routes to School initiative. And this is when volunteers or parents pick up students on foot along a route to school. And then they all walk together like a school bus to make it to school to ensure that everybody's arriving safely, and it's also promoting physical activity. We know that physical activity and nutrition have great impacts on educational attainment and performance. And so if kids are already walking to school, they're getting all their yayas out beforehand so that they can pay attention and really focus on what's being taught to them in school. Another example is outdoor tobacco-free policies. So this can be on any village property or within parks, any way that really makes it harder for people to smoke in public spaces that's going to affect other people with secondhand smoke, particularly making it safe for those who have asthma and other health issues that can be triggered by smoking. And then there's Medicaid enrollment. So this can also be done by volunteers, a very grassroots strategy, or it can also be held at places of worship again, or any nonprofit organization. That's really going to allow people to enroll in Medicaid and make sure that they have access to health care and the things that they need to address their health issues. So again, these are just some ideas and some examples of things people have done with We Thrive, but it just kind of gives you a taste of what the initiative entails. It's by no means limited to these 5 things.
So hopefully we've kind of provided you with a basic understanding of at least the social determinants of health, health equity, and how you as a We Thrive team can begin to address these topics in your community. We want to thank everyone for giving us the opportunity to talk to you guys today and share our insight and knowledge on these topics. So if anyone on the call has got any questions, feel free to type them in that tiny little chat box down on the left side of your screen, and we'd be more than happy to answer them for you.
We'll just take about 30 seconds to a minute for people to ask those questions in the chat box if they'd like. and then we will address them accordingly. All right, so it doesn't look like anybody on the call has any questions, but feel free. You can reach out to us afterwards if you have any questions. This webinar is recorded, so you can listen to it at your leisure. And our contact information, if you want to follow up with us, again, my name is Hannah Smith, and my email address is Hannah, hannah.smith@hamilton-co.org. And you can reach Tom at his email address, which is
Thomas.Boeshart, B as in boy, O-E, S-H-A-R-T, @hamilton-co.org.
And we want to thank you again for joining us, and we hope you found it beneficial.